Can you tell me what rhabdomyolysis is?
Absolutely not.
Do you have any guesses?
No.
Hi, my name is Shane DeBone. I'm an defensive player for the Iowa football team. I'm here to talk to you about rhabdomyolysis. Rhabdomyolysis literally means striated tissue, muscle tissue dissolution, or in simpler terms, muscle breakdown. Myoglobin is one of the major substances released into the bloodstream and further breaks down as substances that damage the kidney. It is caused by any condition that damages skeletal muscle, especially acute trauma or injury. Any condition, whether it be a physical or non-physical in origin, that causes muscle tissue damage may be a cause of rhabdomyolysis. The cause can be a local injury to a region of muscle tissue, or it might be a disorder that breaks down muscle systematically within the body, such as fibromyalgia or muscular dystrophy. The most common causes are direct muscle trauma, such as a crushing injury, muscle tissue compression, alcohol abuse because of the tremors that follow, and the use of certain illicit drugs. This documentary is designed to bring awareness to athletes and other people who may be at risk, such as alcoholics, crush injuries, drug usage, genetic muscular disorders, heat strokes, ischemia, or necrosis to the muscle tissue. Low phosphate levels, seizures, severe exertions, shaking, trauma, electrical shock, or third-degree burns can all be things that cause rhabdomyolysis. I bring you this information in the hopes of preventing others from ending up like I did on January 20th, 2011, laying in the hospital bed after a grueling practice.
Hi, can you tell me what rhabdomyolysis is?
My only guess would be turn into a raptor, something like that.
What is rhabdomyolysis?
I have no idea, but if I had to guess, I would say it was something, I don't know, like with rabies or something. I don't know.
Can you tell me what rhabdomyolysis is?
No, maybe something to do with rabies.
What is rhabdomyolysis?
I don't know, maybe it's a type of disease where it's kind of like rabies, like I don't know, something like that.
My name is Shane DeBone, and I'm here with a Quinnipiac soccer player, Ashley Sear. Can you tell me about your experience with rhabdomyolysis?
Well, it was a hot and humid day in August. We were in the middle of a grueling practice to prep for the big QUDL scrimmage. Looking back, I hadn't drank a lot of water that day, and the heat index was upwards of 100, so I was pretty dehydrated. After practice, I noticed my urine was tea-colored, and I felt nauseous and confused and a little delirious. Just generally, I didn't feel myself. I also felt very weak, and my joints hurt, so I ended up in the hospital, and they saw I had low blood pressure and fever. They did blood work and found I had a high level of creatine kinase, calcium, myoglobin, and potassium. My urine analysis also showed I had high levels of myoglobin in my urine. Then they were able to diagnose me with rhabdomyolysis.
Okay, well,
Sorry.
So how did this impact you? Because that must have been tough getting the diagnosis.
I was really upset because I missed a lot of practice while I recovered, and I really had to watch what I was doing the next couple of weeks at practice. While I was in the hospital, it felt like my whole routine was screwed up. I used to wake up early, go to weight training, hang out with my teammates, and have practice all afternoon. Laying in that hospital bed recovering while my teammates took on the grueling practices without me was torture.
Luckily, Ashley had a good prognosis because of the rhabdomyolysis caused minimal damage to her kidneys. A common complication with rhabdomyolysis is renal failure, which can occur indirectly from injury to the kidneys or from proteins released in the muscle breakdown. This occurs in 15% of patients with the condition.
What is rhabdomyolysis?
A skin disease?
What is rhabdomyolysis?
Well, I think lysis is the breakdown of something, so maybe the breakdown of something in your body.
What is rhabdomyolysis?
A disease coming from rabbits or catching from rabbits or some sort.
Shane DeBone here with Marjorie, who has been struggling with addiction to alcohol for the past 10 years. Can you tell us about your experience with rhabdomyolysis, Marjorie?
Yes, well, I was feeling very weak for a couple months and went to see my doctor. They didn't see anything wrong with me at first, but after a couple urine test, they found an electrolyte imbalance, and I was also diagnosed with muscular atrophy. These two findings, paired with my long-term alcoholism, led to my diagnosis of rhabdomyolysis.
Okay, and what type of treatments did you receive?
My treatment involved flushing out the blood in the kidneys and getting rid of as much myoglobin and harmful muscle tissue byproducts from the bloodstream as quickly as possible. This is done by using fluids through an IV to increase blood flow. Diuretics and bicarbonates may be given to help the patient pass the fluid through their system and excrete the harmful toxins. IVs are also used with fluids to increase calcium levels and decrease phosphate levels in the blood.
Thank you for sharing your story.
Can you tell me what rhabdomyolysis is?
Rhabdomyolysis. I said something to do with the throat because listeria is another disease that I know of, and lysis was somewhat similar in sound. But that's the only reason I came up with that. But rhabdo, Jesus, is it an actual disease that's in your body?
Yep, it's a disease.
Okay, well, where in the body does it lie?
It can be anywhere.
Okay, so rhabdo. It must be like...
Lysis means the breakdown of something, so...
Oh, it's maybe something to do with stomach, with the acids in your stomach, break it down.
Yeah, that's close, kind of.
Yes, yeah.
What would be your guess as to what rhabdomyolysis is?
Something about the bursting of muscles.
Ooh.
Oh.
I'm an OT major, so but I don't know anything else. Ready? Medical terminology.
Hi, Shane DeBone here with 85-year-old Julie Stoles, an older adult with rhabdomyolysis. How did you come to get rhabdomyolysis, Julie?
Well, my bowels had been deteriorating for some time now, and one day last March I fell while emptying the dishwasher. I couldn't get up and couldn't reach the phone, so I stayed on the ground until the following morning when my visiting nurse came. They took me to the hospital and found I had a compartment injury.
A compartment injury is another common complication associated with rhabdomyolysis, in addition to renal failure and electrolyte imbalance. In compartment injuries, there is a swelling and increased pressure in a confined space, or compartment. This leads to compromised circulation, which can endanger the affected tissue. The compartment syndrome is most common after injury to the lower leg or the muscles of the abdomen wall and can require emergency surgery.
After my recovery, I had an occupational therapist come in and evaluate me for my balance and safety, and also made some modifications to my home to make sure that I was safe and I didn't fall again.
That's really good. Thank you for joining us today.
What is rhabdomyolysis?
Something I don't want to get.
As you can see, rhabdomyolysis can happen to anyone, regardless of age, gender, or ethnicity. In the United States alone, there were 26,000 cases reported of rhabdomyolysis, although this number is considered to be very underreported. Know the signs and please seek medical help if you notice any of the signs and symptoms. This is Shane DeBone. Thank you.